We know that this year has been an incredible year in healthcare across the entire spectrum. And a question that I would like to pose to you, and we'll start with Rhonda, how can technology be leveraged to decrease the strain on nurses and reduce burnout?
It's a great question. The goal with nurses is to keep them mobile, right? To untether them from the traditional work environment. And to do that, you have to provide them with the right technology. If you think about in your own personal life, how much of your technology follows you from your home to your car, to your office, to pick up your children or whatever you're doing in your life, it keeps you connected and it keeps you effective in your life. And we can't take that away from nurses. Frequently, when they enter their work environment, they're putting away what makes their personal lives convenient and having to use what is very dated, such as, landlines and fax machines and all of those things that we see them having to use. We see them using multiple disparate devices. With this instrument, you can talk to this whole group of people. And with this one, this device, you can talk to that other group of people. And with this one, you have to page and wait and hope that somebody calls you back. And so when, all the research I've done on how to manage nurses in their work environment and how to get them to adopt technologies, the number one issue they say that really congests their day is just finding people. It's not a huge clinical issue. It's nothing that has anything to do with making somebody better. It's just trying to find the right people. And it's those little things that just wear people down over time until they're like, this is just so difficult.
What Ashma was explaining of, all of these impacts that can happen in healthcare around technology, but specifically mentioning scheduling. What are you seeing and hearing from the front line as we're dealing with this burnout and scheduling and work-life balance in the nursing arena?
Yeah, so I think one of the biggest issues that nurses have felt, and certainly that's the feedback we've been given, again, cautioning, I'm not a nurse, but the feedback that we do talk to thousands of nurses is that the scheduling, and that's a broad topic, but the inflexible scheduling is one of those elements that makes it extremely difficult. That it's their schedules are laid out far in advance. They have no flexibility around that. We had one nurse come to us who was working in one of the major health systems, and she her husband was coming home from Afghanistan. It was, very exciting, time, 30 days in advance. She asked for a day off, and as the date, but the request was actually denied as the date came up, and so she had no choice but to leave. And now she's, of course, working in a float pool PRN, peer diem type capacity. But I think there's scheduling and flexibility, and then there's that feeling of always being on call. Even if you're not technically on call, you're feeling like you're constantly on call because you're constantly getting texts and phone calls to say, we need help. Can you come in? Can you come in? And that and nurses, hard to generalize, but generally speaking, nurses have respond often to a call of need, like somebody's in need, somebody needs help, right? So they feel this kind of just compulsion that I need to go help. I need to go help my colleagues. I need to go help these patients. I need to be there. And then, the feedback we get is that just leads to that burnout. So COVID has absolutely accelerated this, but it is something that primarily all types of healthcare institutions, whether it's health systems or post-acute, they're not quite understanding the damage that is causing, and actually, contributing to the exodus in this case. So solution back to that is, and you probably couldn't have done this without technology previously, but there has to be a way to be more schedule forward. So meaning be more progressive in that way, being flexible, being able to reduce certain shifts. I mean, we have a lot of nurses that are feeling like they're being forced to retire because they can't handle these long shifts either. And especially with the pressure that they're feeling currently. So, there's kind of an acceleration in that retirement element. Anyway, can we reduce the number of hours required for some people? Instead of a 12-hour or even an 8-hour, can they do a 4 or 6 hour? That, if it's that or somebody leaving, let's try to keep somebody around. If the scheduling system is so inflexible, then hire a person, a manual effort to move things around to make sure that we can accommodate the nurses that are feeling close to burnout.